This is Dr. Hardwick. In addition to the discussion she's going to have here, she along with Dr. Haramuth are really the two that brought deep brain stimulation, high-intensity focused ultrasound. They're the ones that have brought all of the very cutting-edge procedures to our place. So I guess you probably won't be showing videos of this, right? So
no videos.
So I'll just let you take it from there.
I have no pictures, no clip art, but hopefully you get something out of it, okay? So I have to tell you that, one, I think in brand, and so I put all the generic names on the slide so that you could keep up with what the medications are called. And, oh wait, where's my clicker? Is it this?
No, it's the big green button.
Big green button, there we go. All right, so what I want you to get from this is I want you to feel comfortable talking to all of us about your bowel, bladder, and sex dysfunction, or your primary care doctor, or if you feel like you can't do it, at least asking for a referral to maybe somebody that can help, okay? They're very sensitive issues, but there's actually a lot of things that we can do to help. So we're gonna start with bladder, okay? And these are kind of the big frequent things that I get comments about. Yeah, there's a frequency, the urgency trouble, you can't get there quite fast enough. And so when the people come to me with this, what can we do to help? Well, medication can be extremely helpful. We gotta be a little careful with some of these meds though. Some of them cause dry mouth, some of them cause a little confusion. We don't wanna trade one for the other. Frequently, if people come in, I ask them, now, how many kids did you have? And did you have them the regular way or not? And so we have to keep in mind that, yes, Parkinson's does cause some bladder trouble, but if you had 6 children naturally, Parkinson's probably is amplifying a problem that was already there. Mm-hmm. Or if everybody in your family got prostate trouble, it is possible that the prostate is the problem and the Parkinson's could be amplifying it because you can't quite get there quick enough. And so to really utilize uro and urogyn colleagues. And so I'm often hunting them out in the doc lounge. And I know quite a few urologists and gynecologists that like this kind of specialty because it's common. Pelvic floor therapy. Now, that is a very intimate therapy, which Ohio Health is so fortunate that they actually have a pelvic floor therapist in our group. And it can help with helping patients to be able to learn how to hold when we need to wait a minute and when to let go when we're actually at the restroom and it's time to empty the bladder, okay? And I feel that it's largely underutilized, but it's definitely an option. The adult undergarments, slip-on catheters, often I have patients that will use these just at night, especially my male patients with the slip-on catheter. If they can't get there fast enough at night and we don't wanna do anything big with their meds, they'll wear slip-on at night and then take it off in the morning. Interestingly, insurance will pay for these things, including the adult undergarments. You just need a script and you need to take it to the pharmacist when you're like checking out or getting your pills. Bring the adult undergarment and the prescription, and insurance often will cover, and a lot of people don't know that part. Botox can be helpful. That's not the kind of Botox that we offer in our clinic, but the urogyn and urology colleagues often will. Okay. Now, bowel. There's a lot of trouble in the bowel department. And often, this is something that people are telling me they've noticed years before the Parkinson symptoms even started. And there's a lot of trials that show decades before they may have had constipation trouble. Nausea and vomiting can be because of some medications, but it also could just be because you're kind of full all the time and you just feel ugh. Weight loss, I'm often fighting and trying to get patients to put more weight on, and I'll talk about a little bit why. And the not being able to fully empty the bowels is another common problem. There's one medication that actually can help with, a couple of medications actually that can kind of help with that, the bloating and then gastroparesis too. Now, in terms of some of the causes for the constipation. Medication, so if you read all that tissue paper thing that the pharmacist sends you home with your pills, almost every pill will say constipation on it. Carbidopa, levodopa has it on the list. And so it could be the medication. Diet changes because the sense of smell has changed. You're not able to prepare your foods as well. A lot of my patients say they don't want salad. They want ice cream and cake and cookies, right? So what helps move the gut? That salad that we're supposed to eat, but you ain't gonna want the salad unless it has a lot of sweet salad dressing, like my 16-year-old would dump the whole bottle of whatnot on the salad, and I'm like, what are we doing? It's a soup. But this could be part of the problem. You're not eating green things anymore. You're eating junk. Just be honest about it, because that's what tastes good now. Decreased movement. It's harder to move. And so you may not feel like going for a walk around the block. You might not feel like going to exercise class. And so this can contribute to the problem. Not drinking as much water and fluids and the coffee. Often some of those bladder concerns kind of drive this. There can be some pathologic issues with like alpha-synuclein and how much there is in the body that could be worsening this. And then bacteria ratios. Now I put this down because I had a quite interesting study that I sent a bunch of people to before. And they would take the patient and their spouse and collect the stool samples from both. And they found out that the bacteria is different between like the spouse and the person that was affected by Parkinson's. And that's kind of how they got some of this data to realize that bacteria changes. So there's a lot of reasons as to why this is happening. So what can we do to help? One, increase fluids. And now I see that when y'all came in here, y'all noticed they gave you papers and water, and I see a lot of water sitting here and a lot gone. I ask my patients to try to drink 32 ounces of water before lunch. Now, you need much more than that. I say before lunch because I want you to not have to go to the bathroom all night, because that's miserable. But you need that water to push things through and help things moving, okay? A lot of people need that morning cup of coffee or hot tea. Don't forget those things, you know? A lot of my patients are retired, so they said they don't need that morning coffee anymore. I said, but your gut does. So encourage the increased fluid. Activity. If you don't move, the gut don't move. So you're used to probably years ago having to get up, get kids dressed, get them to school, get to work, run, move. Yeah, and then the body's like, yeah, that's enough movement. But now if you're fortunate, and when I can't wait till I retire, and I get to wake up and get myself ready and then have a seat and watch daytime TV, well, the gut's not moving, okay? And so I can't tell you how many times I have recommended people go get a dog that you have to walk to make you move. It's a big deal. You need to come to a center like this and push things through, right? Pelvic floor therapy, again, can help. It is that intimate therapy, though, but it's amazingly helpful for people that have a difficult time knowing how to hold in and release and to help teach that. Prebiotics, fiber intake. You know, if you are one of my patients, you know that we have 2 bowls at the desk, one for candy, one for prunes. The things that our parents told us and grandparents told us to help us move our bowels work. So increase your fiber and try and help. Miralax or any of the generic brands is one that I often tell my patients to utilize. Probiotics can help with stool consistency if it's way too hard. It's going to be hard to pass. So consider a lot of my patients like some of those yogurt options, okay? Abdominal pain and bloating also can be helped with some of the probiotic. The Amitiza and Linzess, there are some trials that suggested that those can be quite helpful in helping Parkinson patients specifically with bowel problems. And I have met 2 people, they were in my training years, that needed everyday chronic antibiotics, and without it they couldn't move their bowels. And so that was a very, very severe case. Now, nausea and vomiting. I say that there's a couple of options. There's Zofran, which is easy to get. The domperidone is not easy. That one you kind of have to either get from Florida or get from places not within the 50 states, okay? It's a little tricky to get that one, but it works great. Tygan can help, but that one's another one that's very expensive. It's new, it's branded. Increase the carbidopa. There is a medication called Lodocin, which is, so the carbidopa and that carbidopa, levodopa, the carbidopa part is the part to kind of help with nausea and vomiting. You can increase it or get a script of just carbidopa to help with this difficulty. Sometimes changing the medication delivery. There are some that are patches, there are some that are shots, or even, I tell all my patients to eat with the medicine. I know that Dr. Patel initially said that, you know, it's a little controversial, but everyone eats with it in the beginning with me, and then we shift it away to make sure it's well tolerated. Did you have a question? Okay, all right, so Weight loss. Now, this is a big deal because of falls and wound healing. And if you ever decide to have surgery, I have worked with surgeons that said, this patient is too thin to have DBS. There's nowhere to put it. If we cut them, are they going to heal up well? So I care a lot about, I want you to keep your weight. Okay, so nutrition, dietitian consults can be helpful. We talk about blending up drinks with all the good stuff, like a scoop of ice cream, some protein powder, some fruit, you know what I mean? Whatever it takes to kind of get the weight back on. I put some other options of things you can easily find at the store. Snacks with ease of access. So I love grandmothers because when you go to their house, they got the candy dish, and then all of a sudden a bowl of popcorn arrives, and then there's a bowl of chips here, and then there's fruit, and then, so when the food is out, you kind of like graze, you know what I mean? And so some people have gotten away from that kind of life and culture, but I encourage my patients, get the candy dish back out. Get the food dishes that are just out on the counter, because it may help you just to take a few snacks here and there. Brain stimulation can help because there's a big trial and it said that most people gain about 30 pounds afterwards. I don't know if 30 pounds is true, but that's what they claim. All right, so sexual concerns. So I also, like Dr. Patel, feel that I am a quality of life doctor. And so my family's like, did you save anybody's life today? And I'm like, no. But I help quality of life, okay? And so that's why I talk to patients about some sexual issues. And so these are the most common ones. They're very, very common in our patient population. Like over half of the women have it. About 70% of men have difficulties with these issues. And so I talk to both my married and unmarried patients about this because it is about quality of life, okay? Now, for the men, there are lots of options for the erectile dysfunction, and all of them are quite helpful. I used to write prescriptions for all of these medications, and so much so that they started bringing me samples of all of them for my young onset Parkinson patients especially, and it would easily was approved and would go through without any difficulty. It's a little trickier now. I often have to get urology to help. I don't give it if there's any cardiac concerns or low blood pressure issues, because that's one of the contraindications, and so we work with our urology colleagues otherwise. Apomorphine, which comes in sublingual and in injection, was actually developed for erectile dysfunction. It's an ED drug, and it didn't go well because, one, the people throw up. Two, initially it was a shot, and so that kind of spoils the mood if you're sick and you've had to give yourself a shot. So it was also found, though, that it was quite helpful for Parkinson patients that needed help with movement. So I have patients that may need rescue medication of the sublingual or the shot, and they say, it's got a good side effect. And we say, well, enjoy the side effect, okay? If there are troubles where the romantic encounter is too quick, okay? I usually say, well, let's talk to the urologist. But if you're also having trouble with mood or depression, Celexa or Paxil can help, and it's an off-label indication for the too quick experience. For my patients that are having the too long experience, amantadine has been shown to be helpful. Sometimes when my patients have gone to see the urologist, they have actually suggested that they use adult tools to help. And the one that I've listed has been the most commonly one that the urologists tell them to get. Anti-anxiety medications like Buspar are sometimes also extremely helpful. And I do have a couple of patients that I've sent to urology and they decided to have surgeries to try to help. All right? Now, compulsions in hypersexuality. Now, when I was looking over this this week, I think this number is probably a bit low, because I even think in some of the literature from the dopamine agonists, it's at least 10% of trouble with having compulsions and such. And so when I give a dopamine agonist, and I'm talking about like the Mirapex, the Requip, the Nupro stuff, I tell everybody, now look, this drug might make you do some things that you weren't expecting and cause trouble. And I've heard, and because I put it out there, patients come back to me with the feedback of, oh my, I'm back in the garage looking for old magazines, I'm asking for relations very frequently, and it's causing some trouble at home and things of that nature. So I kind of put it out there. You're wired the way you're wired. And so some patients like to shop, some like to gamble, and some like sex. And so you just have to be aware that that could happen with these medications. If it does, we try to decrease it. If we can't, we may shift to levodopa more and see what we can do to try to help, okay? All right, so the decreased libido issue. Well, we have this part of our brain called the nucleus accumbens, and its thing is pleasure and joy, and it's part of that circuitry. And part of it needs dopamine to function. And so Parkinson patients have a lower dopamine level, and so this is really a common problem. And they did studies where they gave patients testosterone, the male patients testosterone, to see if it would help. And they thought, yeah, it helped their mood, it helped their apathy, it didn't help their Parkinson's, but it helped all those things. And so this is in that category of sometimes other things kind of get amplified by the Parkinson's. Testosterone goes low. After 40, most men lose 1% to 2% a year of their testosterone levels. And so be mindful of this. Bring this up to your primary care doctor. Or do you need to see endocrine? Is it actually much lower than usual? Are there things that we can do to help? Okay? I think I've already covered this part. My lady patients, so they also have trouble with the hormone changes, and they also have difficulty with some of the additional troubles that come with as we get older, things change. And so, yeah, I will tell patients, consider lubricants. There's some that are suppository type that my gynecology colleagues often recommend. There's a radio frequency type also, where they can do these treatments to bring back or help trouble with tightness and dryness specifically. They're often not covered by insurance, but they're there. And so definitely reach out and say, hey, I think I might need to see my gynecologist, or the pelvic floor therapist can help. All right, now, logistics. So I have frequently referred patients to physical therapy if they're having logistics issues. Sometimes it's like, how do we get in the correct position? My physical therapist say, this is something that they talk a lot about with people that have had a hip replacement, because that's a big joint issue. And so this is something that they very frequently talk to with Parkinson patients of movement is not as easy, and it's not as easy as to shift and move around. And so they commonly say the person affected with Parkinson should be on the bottom, but physical therapy can help with helping with that logistics. Timing. Morning might not be the best time because you've not had your medication all night. And so just be mindful of that. Using the bathroom first. If you have that bladder issue, that might take care of some of the stress or anxiety. And then where the patient versus the spouse speaks, which kind of leads to what Dr. Hinkle just spoke about. If you have REM sleep disorder and your wife is in the guest room, well, then somebody got to, you know what I mean? Somebody got to move. All right? That's what I tell her. So some of the more controversial treatments could be deep brain stimulation surgery, specifically the SDN target. It's thought to help with decreasing medications that cause some of the hypersexuality. I've never referred anybody for DBS specifically for this. Treating with hormones, I personally have never done this, but other folks, I've referred people to their PCP or their endocrinologist, and they've been helpful. Well, I also have to really bring in the spouse to talk about, some of the changes. And so sometimes it's like a change in role, like we're more caregiving and you're not feeling the spouse part as much. Do my patients need to go to counseling? I have diagnosed people in their 30s and they're still planning on having children. So this is a big thing that we have to talk about and bring into about their medications and things that can be helpful or not helpful. And then the hypersexuality piece. Sometimes my patients are hypersexual and the spouse loves it. And I have sometimes the spouse says no. And so this really needs to be discussed. Or if they're saying, hey, I'm having trouble with erectile dysfunction, and I say, well, should we start a medication? And the spouse is sitting there doing one of these. We got to delve into that a little bit, okay? And so this isn't, unless they're an unmarried person, I don't proceed forward with treatment unless the spouse is completely on board.